So which one to choose among dobutamine, milrinone, or levosimendan?
All
Any?
right, so I would still choose dobutamine at a very low dose, knowing, of course, it's a minimum dose. Start with small doses, knowing, of course, that any adrenergic drug, including noradrenaline, adrenaline, dobutamine, all of those drugs have been shown in observational studies to actually be deleterious. Right, so we're starting dobutamine just as a stopgap measure to increase organ perfusion. Start at a low dose. The price, of course, is tachycardia, and then you have all sorts of other problems. Milrinone is attractive. We know that it bypasses the adrenergic pathway, and there are some people who believe in milrinone for right heart support, but there's really very little evidence of any of this. Levosimendan, I would be extremely cautious with, for several reasons. Levosimendan, well, the LEPIDS trial that showed that levosimendan given to patients with septic shock, although they did not specifically give it for septic cardiomyopathy because there was no echocardiography done, it was actually deleterious. It was bad for patients, right? And then in a secondary analysis where they tried to stratify patients according to septic dysfunction, not according to echocardiography, but I think it was according to, I'm not sure what it was. I think it could have been according to troponins. Again, there was, it was not beneficial for patients. So I would be not based on that study, but based on physiological thinking. I know that levosimendan will affect our potassium ATP channels that are already affected in sepsis and septic shock. This is the reason why they have vasodilatation, or one of the major reasons why they have vasodilatation. So why kill off the few receptors that are still functioning? And you know that when you start levosimendan, you are definitely going to need more noradrenaline.
So basically, in and all, when I see the LV is depressed, I can try with the one of the inotropic, start with the dobutamine, and maybe looking at the 2D echo, if I see maybe the VTI improves or the patient's overall other vasopressic requirement goes down, then I know is doing well. I can think of milrinone in the right dysfunction of the acute pulmonary hypertension, but as you said, we are not very sure how it's going to be useful in those situations. But that is the only area where I can think of using it. Levosimendan, of course, the biologically has been shown to be very supportive, but the trials have not shown any good results in those favor. Is that the thing?
No, and in fact, yeah, that's correct. And in fact, even a deleterious, possibly deleterious outcomes for patients, and also, also physiologically, it doesn't really make sense. However, there are niche indications for levosimendan. I can't say no, don't ever use it. So in patients where you expect or where you suspect that beta blockade is playing a role in your decreased contractility, because some of our patients come in on very high doses of beta blockers, right? And they continue to take the beta blockers despite, liver and renal dysfunction. And you suspect that beta blockers has a role in your decreased contractility, then maybe I would consider levosimendan or milrinone. Yeah, or milrinone. The problem with levosimendan is, the K-ATP channels in septic shock. You can't take it away. It takes a while before before the effect comes in. And I'm desperate when I have a patient with, in front of me, and that contractility is poor, and I don't have time to wait for the levosimendan to kick in. But those niche indications, beta blocker toxicity or beta blocker effect, possibly weighing in, then I might consider levosimendan. But probably I would use milrinone first, easier to titrate. But definitely dobutamine would be my first choice, not because I think it's a good drug, but because I think it is probably the drug that is easiest to titrate. I can take it away quickly. It's the cheapest, and I don't think that in that particular in a patient with a manifest sepsis-induced myocardial dysfunction, I would go with something that I know I can control better.